we're moving on to our next agenda item of our monthly Calhoun Liberty Hospital Board meeting. We have with us this evening one of our nurses, Hayley Sumner, who's here to talk to us about mental health issues due to COVID. Ms. Sumner?
Thank you, Madam Chair. So as many of you may not know me, my name is Hayley Sumner again. I'm a nurse practitioner student at Auburn University, and I'm also a staff nurse here in the emergency room at Calhoun Liberty Hospital. I've been here for about 5.5 years. This is the first pandemic that I've ever had to work through as a nurse, but I can already see how quickly things are changing and how much things have changed since COVID-19 became a global pandemic back in March. And so tonight, the reason that I wanted to come and talk to you guys was because now a lot of you are aware that we have a very small support group in this hospital. And we started this back in May. It was just me and a couple of other of my cohorts, and we were meeting once a week in the cafeteria, and we still do that every Tuesday night. And it initially just was a place where we would come. There was only 3 or 4 of us initially, and we would just kind of talk about some of the stressors and things that were arising during the time when the pandemic was really peaking in this small area. And it initially, was just a place to come and just talk about things, but then it kind of became more of a problem solution kind of type meeting. So we were talking about all these different problems, and then we were like, at what point do we start looking for solutions to these problems? And so I'm here tonight just to tell you guys kind of what's going on in this hospital, because it's not just on TV, it's not just global, it's here in Calhoun County. And so this is not just nurses, this is healthcare providers. So we're talking even dietary, radiology, all the departments in this hospital are seeing effects from this. And so we've been meeting, like I said, and now we're to the point where I said, let's just go to the board and see what the next step is. And so there's some contributing factors that all play a role in this. So I just wanted to open up the floor to some questions and see if there's anything that you guys, any input that you have on this issue.
What are some of the contributing factors, do you think, that staff experience through this mental distress that they're experiencing?
Well, a lot of it is fear, anxiety. Like, these are the issues, the mental issues that we're talking about is fear, anxiety, depression, and just stress. And so a lot of the stress, I think, and the anxiety that nurses and providers are having in direct patient care is all going back to our PPE, personal protective equipment that we have, our masks. Do we have the proper mask? Are we having to reuse the same mask? Do those masks that we're picking up and reusing every time, do they have COVID germs on them? And these are, in our gowns, where at one point we were running out because it was, peaking. But now it's a little bit more on the downfall, but we still have these effects. So PPE is one. Nurse-patient ratios, we're seeing more critical patients, but we're still expected to carry the same patient load in the emergency room, so that becomes a factor. And then I think a lot of anxiety and just kind of apprehensive feeling toward all the changing guidelines. I feel like every time I come to work, there's new guidelines from the CDC. And it's not your fault, but the administrators are having to come up with these policies and these protocols that line up with these guidelines, and it's hard for us, to keep track of them all, quite frankly. And so that's one. And then just moral distress and conflict, meaning, we want to do the right thing, but sometimes what is the right thing? We only have 1 or 2 ventilators at this hospital. If we have 2 sick patients and 1 ventilator, who gets the ventilator? Who gets transferred first to the highest, to a higher level of care? So those are some issues that are a problem.
We're a really small hospital and our funding is very minimal. Do you have any ideas? Have you come across any possible funding options for us? Grant funding, anything like that that could help fund some of these mental health ideas that we're coming up with?
I brought with me tonight, and I'm just going to let you guys kind of read over them because it's a lot, but this is a piece of legislation that was passed in Michigan, by a congressman of Michigan, but a U.S. congressman, and it actually is in support of mental health awareness in healthcare workers across America, and this would create grant programs that would help prevent burnout, depression, and mental health issues in healthcare providers, and it's basically just comes up with funding to have things like counselors available for nurses who need them, mandatory breaks during the work shift, different things like that. So that's kind of a starting place.
Definitely need to look into some of these.
Yeah, I think
Funding
that this would be an excellent beginning point, and I am so thankful that you brought this matter to our attention tonight. It's extremely important that we look after our staff here at Calhoun Liberty, and I just want you to know that I support your efforts, and this board will work hard to help you and the staff meet this crisis head on, and us implementing programs that will get the necessary funding to see that you're cared for.
Thank you. I agree.
Thank you for sharing with us this evening, Ms. Sumner, and we look forward to maybe having you back next month at our meeting and working with you going forward on this important matter.
Thank you.
Thank you.